QRS activates the cells. That's a good head word. Referring to this, I would like to invite another experienced QRS doctor to our discussion round. I welcome Dr. Klaus Schmidt. Hello. Mr. Dr. Schmidt, you have also been working for a long time as a local doctor with QRS, but you are concerned especially in the prevention of the heart, aren't you? Yes, I'm a general practitioner, sports physician, and chirotherapist. From a personal experience and conviction, the prevention of diseases is for me a determined area of medicine. Just in addition, there always is new scientific knowledge. The medicine of prevention is getting more and more an approved medical department. That's why you went again to school. I've just made my degree as one of the first graduates in the first European master's degree in preventive medicine at the Dresdner International University. Now I'm Master of Science in Preventive Medicine. And I'm a little bit proud of that, if I might say this. Congratulations, that's a great performance. And how does QRS fit into this picture? Since when do you apply quantum medicine on your patients? I know QRS already since 1997, and like all the others in this round, I also have been convinced by my own experience of QRS. Please tell us. You know, already in my sports studies, I have dealt intensively with prevention. That's why for me, preventive medicine is the medicine of the 21st century. Diseases must already be prevented before they can originate. For this purpose, healthy nutrition and sporty activities belong to that. For me personally, movement is essential for my well-being. Without sports, I'm completely unbalanced. And how did you come in touch with QRS? 1997, I've had within 10 months 5 muscle tears in my left calf. Despite all sports medical treatments, I didn't become fit again. Then a friendly colleague recommended me QRS. Already 3 weeks after my last fiber tear, I could participate in a mountain run competition. And after following 6 weeks with QRS applications, I ran my first Köln marathon. This convinced me personally. And then you applied QRS also on your patients. I've been using QRS for almost 10 years on my patients. QRS is the original therapy system. These successes have arranged me to deal intensively since years with the positive influence of quantum medicine on the human organism. How does this look like concretely? As first doctor in Germany, I could already use in 2003 the QRS doctor system in my health institute. It allows an optimal individual therapy form. With this system, I played a part in the big European doctors' study of QRS. Moreover, I have published numerous scientific technical contributions in the area of the magnetic field therapy. But now please more precisely, for which diseases do you apply QRS in your practice? However, for the majority of chronic diseases, the pharmaceutical industry could fight only against the effects, like pain. The real disease often can't be healed until today. And that's the great thing about QRS. Obviously, every cell is stimulated and the self-healing process is activated. To me, QRS sounds like a real universal remedy. Basically, I always defend myself from such a denomination. QRS is no mystical wonder drug, but an approved medical therapy form with approved medical devices. I always tell my patients that they don't have to expect a miracle healing. It's not like that all diseases in this world can be healed with one single application. In fact, QRS is a long-term therapy with which the first improvement in most of the cases enters after 2 to 4 weeks. In most cases, you reach the optimum only after 6 to 8 weeks, namely only with regular applications. And then the therapy application has finished, Dr. Schmidt? Ideally, the therapy should be continued also after and for a long term. And this way, the cells are preventively strengthened and immunized against new illness pushes and other diseases. As a prevention, twice a day for 8 minutes is enough. So altogether, only 16 minutes a day, and you stay healthy and fit? Exactly. In this way, you optimally can prevent illnesses and vitalize your immune system. You know, the patients in my practice as sports doctor of course want to preserve their efficiency or even increase it. Also here, QRS has been applied very successfully for years. So QRS is something for everyone? For ill and healthy persons of every age? Yes, right. QRS shouldn't be applied only in acute cases, but also preventive. The best thing is staying directly healthy. Mr. Dr. Schmidt, I have one more question. We always talk about QRS, the original. Can you give reason from your experience? Yes, I can. You know, I have tested a system of a fellow competitor of QRS in my practice in the meantime. The very positive results I have had until then got dramatically worse after using this competition system. So one thing is certain for me. The decade-long basic research and development of the Professor Dr. Fischer AG pays off. During this time, excellent and effective therapy systems have been developed. That's why I'll keep QRS. Thanks for your contribution, Mr. Dr. Schmidt. You're welcome.